My name is Louise Binder, and I'm the health policy consultant with the National Melanoma Patient Group, Save Your Skin Foundation. And I've been working in patient advocacy for over 25 years, the last 6 of which have been in the oncology community. I'm sure it'll come as no surprise to this audience that as a result of the COVID pandemic, Canadian hospitals, overwhelmed with COVID patients, have had to cancel cancer surgeries, treatments, diagnostics, screening, testing, and follow-up appointments. This has been devastating for patients, both in terms of their fear for their physical health and the implications for their mental health of the uncertainty of these times. And they've turned to patient oncology groups to represent them and assist. As a result of the needs that they expressed, 14 national oncology patient groups banded together to create a hub which provides mental health and wellness supports, practical supports, and a list of frequently asked questions and government and community resources. Since it started in April of this year, our hub has provided more than 400 round-trip taxi rides for patients to healthcare appointments in the Toronto and Montreal area. We anticipate that the need for these services are only going to grow and expand. We've also provided mental health supports through an 8-week mindfulness program, as well as access to links to cost-effective programs for one-on-one individual support. We have consolidated more than 70 national and provincial government and community-related, COVID-related support links, and we have continued to support people on a small group and individual basis. This hub has been profoundly important to oncology patients during the first wave of this pandemic and will continue to be, no doubt, during wave 2. Of course, the problems of lack of adequate mental health services for oncology patients and the lack of access to practical supports such as transportation are not new. Certainly, the issue of social determinants of health in accessing health resources is nothing new either. Policymakers must address the issues facing cancer patients as well as others who need healthcare services during the time of this pandemic.